Good afternoon. Thank you for joining us on this edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Today, we are going to be talking about physiotherapy. We'll be telling you about what it really means, who needs the services of a physiotherapist, and how does it work. But answers will be after this short break. Welcome back. With me in the studio is an expert. He's called Franklin Shubu. It is a pleasure having you on the program today.
Thank you, Immaculate. It's my pleasure to be here.
So briefly tell us about yourself.
Well, like you said, I'm Franklin Shubu. I'm a physiotherapist for many years now, and I'm a physiotherapy course instructor.
Okay. So now we are going to be talking about physiotherapy. What exactly is it all about?
Physiotherapy is a health profession that provides services to develop, to restore, and to maintain function and movement. You will notice that there are three keywords in the definition. You have develop. It means that somebody can be there without movement. A physiotherapist can help the person to develop this movement capacity. While it can help to maintain, for somebody who is already able to work, he can maintain a particular health situation and restore function. It means we have many diseases nowadays like stroke, post-stroke, paralysis, that physiotherapists can help to restore the function after it has been lost. Okay. But there are two other words that are often overlooked when we talk about physiotherapy. We have health prevention and health promotion. So physiotherapists also come in preventing health, which is, I think, the most important thing our healthcare system should be talking about.
Okay. So who needs to see a physiotherapist?
Generally, the conditions are many, but I would say...
Let's say 4 major conditions that are really very popular in Cameroon.
We can say post-stroke hemiplegic patients because they have loss of function after that. We have joint pain, which can result from many other situations. When I mean joint pain, I can say back pain, neck pain, knee pain. There are many. We have orthopedic situations like deformity, like clubfoot, which need physiotherapy for correction, and we equally have traumatic cases like fractures, post-injury, that can need physiotherapy services. But I want to precise that in all the health specialties, physiotherapists can come in one way or the other.
You mentioned the 4 major types, the major pathologies that will need physiotherapy. So now I want to know, are the treatment techniques the same?
No.
How do they differ? Can you please explain to us?
Well, they differ because every patient is different from the other.
Okay.
And every pathology is different from the other. That is why in the practice of the profession, we need to start from some initial phases of evaluation and make sure that the techniques we apply respond to the particular problem the patient is suffering from.
Let's say in the case of someone who's suffering with nerves and someone who has a stroke, how would the technique, what would be the difference in, let's say, is it massage or the different techniques you use to help such a patient to become better?
Thank you for this question. For somebody who is suffering from stroke, post-stroke, I like to say post-stroke hemiplegia because the paralysis is a consequence of the stroke that may have already been treated by medical doctors or the physicians. There, the main objective is to restore function.
Okay.
So the techniques we're going to use will mainly be techniques going in the line of restoring function in terms of exercise, in terms of other physical agents like electrotherapy we're going to use. But if we take, for example, the case of nerve pain,
yes,
nerve pain can come from many other medical problems, but generally we'll be looking at how are we supposed to calm pain. And now things like soft tissue manipulation, or what generally is called massage, stretching techniques, mobilization techniques, and therapeutic exercises can help to calm nerve pain. The important thing is to focus on what is the pathology, what evaluation have I made, what are the objectives we want to achieve. This aspect guides you on how, or guide the physiotherapist on how he has to draw his plan of treatment.
Okay. So now, okay, we have lots of spas that offer, let's say, massages and all of that. How different is such a person from a physiotherapist, someone who works in a spa and is a massage expert?
I really want to thank you for this question because many people think that physiotherapy is just all about massage. I want to make it clear that the spa personnel depends on what they are training. Their main object is to relax people from stress. That's why they always do spa most of the time during the weekends, after you've had a stressful week of work. But the big difference comes because their trainings are different.
Okay.
Why the spa personnel will just receive training on how to relax the patient, but physiotherapists go a long way to understand all the medical pathologies and see exactly what he can do for which specific pathology. Meanwhile, I also want to precise that physiotherapists can equally work in spas. It means the spas can equally have its massage therapists and have a physiotherapist who will be there to also take care of patients who may have medically diagnosed problems that physiotherapy can help.
In case I have a pathology that needs the services of a physiotherapist and I go to a spa and my problem is not resolved, are there long-term consequences?
Yes, for sure, there can be consequences. And those consequences can be that either your situation, your medical situation in which you went to the spa for is worsened, or it is delayed, or the improvement is delayed.
Okay. So now, what are the different domains of physiotherapy?
Yeah, physiotherapy really have many domains today. We have specialties in neuro rehabilitation. It means a physiotherapist who specializes to receive only conditions that have to do with nerve problems, neurologic disorders. We have equally physiotherapists for musculoskeletal problems, so any problem of the bone and the muscles. And we have physiotherapists for orthopedics, deformity, or traumatology, post-fractures management. We have physiotherapists who can be specialized in cardiorespiratory problems of the heart, the blood vessels, and equally the respiratory system. We have physiotherapy in pediatric little children, and we have physiotherapy in geriatrics, equally for older people. We equally have physiotherapy in sports. You bear with me that each time there's an injury, it's not just the medical doctor that is there. You also have a physiotherapist who is part of the health team for sport. And of course, there are some branches that are yet to be developed, but that are already functional somewhere, which is physiotherapy in oncology. I know it may be shocking, but post-mastectomy, for example, surgical removal of the breast, there are a lot of physical exercise can really help such patients, and in other metabolic conditions like diabetes.
Now, it's very common to see a young girl, a young boy telling you they have nerves. Or before we used to think it's just for old people, but now it's changing. In such a situation, what's the best treatment option for such when it comes to physiotherapy?
Generally, in physiotherapy, to define a treatment, something must precede, which is an evaluation, because treatment plans may differ with respect to the cause of that nerve problem.
Okay.
But now, in a general perspective, each time we have nerve problem, most of the things patient complain is like pain, is weakness, is numbness. So in most cases, physiotherapists will use techniques like soft tissue manipulation, some flexibility exercises, and for sure some physical agents. And when I mean physical agent, can mean the electrotherapy, some other agent physiotherapists can use to calm pain or to help the patient to relieve from the symptoms. But let me precise, each treatment protocol is individualized. It means it's not something that is general, that if patient A comes and apply the same thing because she has nerve problem, and patient B comes and apply the same thing.
Okay.
I have to
know the causes,
okay, and try to treat the patient in the sphere of the patient.
If you're just joining us, then know you're watching. For those who are on TV and listening to the program, for those on radio, You and Your Health at an Equinoxe Radio Multimedia, and we are talking about physiotherapy. To participate in the program, the numbers will be displayed on our screens. You can call the following numbers: 655-511111. I repeat, 655-511111 or 652-025050. 50. So back to you, doctor. For a person undergoing this process, what are some of the things they need to abstain from?
Generally, when a patient is undergoing treatment, the prescriptions or the advice we give them depends on the condition they're suffering from. But generally, I will give a general situation advice, and I will give a specific advice to low back pain that many people are suffering from. Generally, we always advise the patient to stay away from people or the doctors in the quarters. Yes, to put it this way, because there are many patients when they come to the hospital, they do a lot of things and they tell you that my neighbor told me that when she had this is what she does. It's very destructive and it really influences in a negative way the treatment process. Generally, they need to avoid stress. Stress is something that is taking the society to another level.
Yeah.
And stress can influence any pathology you have. Just having pain that can result from a medically diagnosed pathology and having stress is increasing the suffering. So we always advise patients to stay away from stress. Now, for example, somebody with low back pain, we're going to advise the person to stay away from faulty positions or awkward positions during regular activities. We're going to advise the patient to stay away from particular activities that can lead or worsen the pain. That is why during the evaluation, we take the history of the patient. We have to know what the patient is doing as a profession, to know exactly if at that period, what are the things that we can restrict the patient from doing in order to fasten the healing condition.
You talked about stress. How can stress be managed? We know how difficult the economy is. We know how life can be really hard. In such a situation, how do we manage such?
Well, I can't say I have the solution to it, but I can say what I often say to some patients and to some people at times. I just always ask you to put your situation in front of you and ask yourself questions like, the situation is there. Can I change it?
Okay.
No. What can I do about it? That is the important question to ask. Because if I'm already having pain because I'm suffering from a spinal injury or something else, the situation is already there. It's not the amount of stress I focus on this that is going to help me to come out of the situation. Exactly. It's already there, and we have to accept our different situations. Because one thing that makes people not to be so stressed or to be so stressed is that they don't accept
their conditions. Okay. So in cases where physiotherapy does not work, what are the different options?
Well, I would say physiotherapists do not stand out alone. Like we always say, they are part of a health team. Physiotherapists work in collaboration with medical doctors, nurses, and the other healthcare professionals, which will mean that physiotherapists, they will discuss on the situation of the patient, and they will both, or in a team, decide what is best. But I always say that physiotherapists is always needed, because when you go by the definition, they maintain function. You may be in a situation that you are not the best of your functional capabilities, but you cannot also bear to lose what you have already gained. Okay. And a physiotherapist can help you to maintain that particular state of functionality you have.
Can anyone become a physiotherapist? Or let's say, can I describe any doctor as a physiotherapist?
No. To be just like any other health profession, there are criteria to be admitted for a formation program, and there are a certain number of years you must study to be called a physiotherapist. In Cameroon, as of now, the text from the Ministry of Health says you need to have a baccalaureate DOC, you need to have an advanced level in sciences, excluding religion, to be able to be eligible to be trained as a physiotherapist. When you have all this, you can either be formed in a private institution or some public institutions for 3 years minimum. But to be a full physiotherapist, you need a degree, which will take 4 years in private institution or maybe 3 years in some public schools.
So now tell us, what's the difference between physiotherapy and physical therapy?
Well, there is no difference actually between the two. It's just the appellation.
Okay.
In the UK, British system will call it physiotherapy, while the Americans will go for physical therapy.
Okay.
Yeah.
So now, as a physiotherapist, what are some of the setbacks or challenges you guys are facing, especially with our Cameroonian context?
Thank you very much for this question, Immaculate. In our context, physiotherapists face three major problems. The first one is lack of awareness. And if I have to quote D. Jackson, who said lack of awareness or poor awareness concerning the profession can lead to misconception and even interprofessional conflict. Okay. That's the situation in which I place physiotherapy today. The public awareness is very low, and even when it comes to, even among healthcare professionals, many are yet to really know what
physiotherapy is all about,
and it's practiced, not just knowing that it is a healthcare profession, but knowing who can be referred to a physiotherapist, in which situations can a physiotherapist come in, is still a real big problem in Cameroon, which we are hoping that increase in sensitization campaigns and can really help, and maybe including physiotherapy training programs or courses to medical students, so by the time they leave medical faculties, they are aware of which conditions they have to refer to physiotherapists. The second problem I would like to mention here is who practices the profession in Cameroon. This is a big problem now because we have many other health professionals who are substituting themselves to be physiotherapists in some situations, and we even have non-healthcare professionals
into the profession
because they think that it's just massage,
yeah,
who substitute themselves into the profession. And I think that it's a real problem because the world today, there are a lot of cases of disability in the world today. And if patients do not know the right people or the right professionals to refer to, we may be running at a situation where the disability is increasing in the world, and we all know that a disabled profession or population cannot be productive.
Thank you so much, Dr. Franklin Shubu. He works at the Pan-African Hospital Center right here in the city of Douala. And that's where we end this edition of the program, You and Your Health, aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe, and I received technical assistance from Ephraim Yemeli. Stay blessed in the company of more programs on Equinoxe Radio and television. And don't forget, your health means health.